The United States government just announced that everything we've been taught about nutrition for the past 70 years might have been wrong. Red meat is now encouraged to be eaten more, bread has been pushed to the bottom, and whole milk suddenly became the hero. I've spent 30 years treating cardiovascular patients, and when I saw this new food pyramid, I have to admit that my first reaction was, are they kidding me? But no. This is the official guidance from the Department of Health and Human Services under President Trump and Robert F. Kennedy Jr. So the question everyone's been asking me is, should we trust it? Is this a medical revolution or a disaster waiting to happen? And more importantly, if you're over 60 years old, have a history of heart disease or diabetes, should you change the way you eat right now? I'm going to tell you exactly what I think, no holding back, because your health is not a joke. And I have to warn you up front, some of the information in this video might surprise you, it might even confuse you about what you've been eating your entire life. But don't worry. I'm going to walk through this with you step by step, explain everything in the simplest way possible, and at the end, I'll tell you exactly what I recommend my patients do in this situation. If this is your first time on my channel, I am Dr. Saul Whitman, Chief Medical Officer at Northern Institute for Society Wellness, with over 35 years treating thousands of patients with cardiovascular disease, atherosclerosis, stroke, and hypertension. And now, let's get into the video. The background of the new food pyramid. In early January 2026, the Trump administration officially announced the new food pyramid for the period 2025 to 2030, and I have to be straight with you, this is not a small update. This is a complete reversal. Robert F. Kennedy Jr., who is now serving as Secretary of Health and Human Services, stepped up to announce this food pyramid with the main message of eat real food, meaning eat real food. Sounds simple, right? But when you look at the details, things become much more complicated. In the old food pyramid that we've been familiar with since the 1990s, the base of the pyramid was bread, cereal, rice, and pasta, with recommendations from 6 to 11 servings per day. Protein like meat, fish, and eggs were on the upper tier with only 2 to 3 servings, and fats, oils, and sweets were at the top of the pyramid with advice to use them very sparingly. That's what we've been taught for many decades. But now, the new pyramid has completely flipped it. Protein, dairy, and healthy fats are now at the top priority. Vegetables and fruits are also placed at the same priority level. And whole grains have been pushed down to the bottom with only 2 to 4 servings per day, and white bread and refined pasta are almost completely eliminated. Can you imagine that? What we were told was the foundation of our diet is now considered something to be limited. And this leads to the biggest question. Why is there this change, and is it based on science? The reasons for the change and key points. The Trump administration and RFK Jr. argue that America is facing an unprecedented chronic disease crisis. Rates of obesity, type 2 diabetes, and cardiovascular disease are rising, and they believe a large part of the cause comes from eating too many refined carbohydrates and ultra-processed foods. And I have to admit, on this part, I agree. According to a study from Harvard School of Public Health, approximately 60% of the calories that Americans consume daily come from ultra-processed foods, and this is exactly the type of food that causes chronic inflammation, creates unstable blood sugar spikes, and leads to cardiovascular diseases. So when the new food pyramid recommends drastically reducing processed foods, added sugars, and refined carbohydrates, I think this is a step in the right direction. But this is where I start to have concerns. The new pyramid doesn't just stop at reducing processed foods, it also encourages increasing protein to nearly double what it was before. Specifically, they recommend 1.2 to 1.6 grams of protein per kilogram of body weight per day. To make it easier to visualize, if you weigh 154 pounds, which is about 70 kilograms, then you need to eat 84 to 112 grams of protein each day. Compared to the old recommendation of only 56 grams, this is a significant increase. And to achieve this protein level, the new pyramid places red meat, chicken, fish, eggs, cheese, and whole milk at the top priority. Now, this is the point where cardiologists like me start to have serious questions, concerns about red meat and saturated fat. Throughout my 30 years of practice, I've witnessed thousands of patients with cardiovascular disease. And one of the biggest risk factors we always have to control is high LDL cholesterol, or what we call bad cholesterol. And one of the main causes of increasing LDL is saturated fat, which is abundant in red meat and whole milk dairy products. A major study from the American Heart Association showed that replacing saturated fat with unsaturated fat, like olive oil or nuts, can reduce the risk of heart attack and stroke by up to 25%. So when I see the new food pyramid putting red meat and cheese at the top, I have to ask, is this safe for people who already have cardiovascular risk? And my answer is not necessarily. If you're a young, healthy person who exercises regularly, then increasing protein and eating more meat might not be a big issue. But if you're over 60 years old, have a history of high cholesterol, high blood pressure, or have had a heart attack, then suddenly increasing the amount of red meat and saturated fat could make your condition worse. I have a patient, he's 68 years old, he had a previous myocardial infarction, and he ate steak and cheese so much that it became a habit hard to break. But when he came to my clinic for a checkup, his LDL cholesterol was at 140 milligrams per deciliter, and I had to adjust his medication to help clear the cholesterol and redesign his meal plan with more fiber. This is exactly what I'm concerned about when people misunderstand the message of this food pyramid. The positive aspects of the new food pyramid. But I don't want you to think that I'm completely against the new food pyramid. In fact, there are several points that I fully support, and these are things I've been advising my patients to do for many years. First, the message "eat real food" is completely accurate. We need to eat whole foods that are minimally processed. Instead of eating boxed cereal full of sugar, eat whole grain oats. Instead of drinking soda, drink filtered water or unsweetened tea. Instead of eating packaged snacks, eat nuts or fresh fruit. These are simple changes, but have a huge impact on your cardiovascular health and blood sugar. Second, encouraging people to eat more fresh vegetables and fruits is wonderful. The new pyramid recommends 3 servings of vegetables and 2 servings of fruit per day. And this is exactly what I've always advised my patients to do. Vegetables and fruits are rich in fiber, vitamins, minerals, and antioxidants, all of which help reduce inflammation and protect your cardiovascular system. Third, reducing added sugar and ultra-processed foods is a major step forward. According to a study from Mayo Clinic, reducing added sugar intake to below 25 grams per day, which is about 6 teaspoons, can significantly reduce the risk of type 2 diabetes and cardiovascular disease. And I've seen this in practice with my patients. When they cut down on sweets and sodas, their blood sugar stabilizes, their weight decreases, and their mood also improves. So in this respect, I think the new food pyramid is heading in the right direction. How should we eat now? Now, this is the part you might have been waiting for. With all this information, with the positive points and the concerns, what should we do? Should I change the way I eat? And my answer is, it depends on your individual health condition. This is the most important thing I want you to remember. There is no one diet that fits everyone. If you're a healthy person with no history of cardiovascular disease, no diabetes, normal cholesterol, and you exercise regularly, then increasing protein and eating more whole foods as the new pyramid encourages might be a good choice for you. But remember, protein doesn't only come from red meat. You can get protein from salmon, tuna, chicken, eggs, beans, nuts, and Greek yogurt. Don't just focus on red meat and cheese, but if you're over 60 years old, have high cholesterol, high blood pressure, or have had a heart attack, then I recommend you be more cautious. Instead of eating a lot of red meat, prioritize fatty fish like salmon, mackerel, or sardines because they're rich in omega-3, a type of healthy fat that helps reduce inflammation and protect your cardiovascular system. Instead of eating cheese and whole milk every day, eat them in moderation and combine them with more vegetables and fruits. And most importantly, talk to your doctor before making any major changes to your diet, because each person has a different health condition, and what works for one person may not work for another. Practical advice from experience. I want to share with you some practical advice that I've applied with my patients for many years, and this advice still holds true regardless of what the new food pyramid says. First, think of your plate like a colorful painting. Half of your plate should be vegetables, 1/4 should be protein, and 1/4 should be whole grains or healthy starches like sweet potatoes. This is the simplest way to ensure you're eating enough nutrients without having to count every gram of protein or every serving. Second, drink enough water. Many older adults don't drink enough water, and this can lead to dehydration, constipation, and even increased blood pressure. I recommend you drink at least 64 ounces of water per day, which is about 8 cups. And if you're exercising or it's hot outside, you need to drink more. Third, move your body every day. You don't need to run a marathon or lift heavy weights. Just walk for 30 minutes a day, or garden, or play with your grandchildren. Anything that gets you moving is good. Physical activity helps lower cholesterol, stabilize blood sugar, and strengthen your cardiovascular health. And finally, get enough sleep. Lack of sleep can increase cortisol, the stress hormone, and this can lead to weight gain, increased blood pressure, and increased risk of heart disease. I recommend you sleep 7 to 8 hours each night and create a consistent bedtime routine to help your body relax. So we've gone through the entire issue about the new food pyramid from the US government. Is this a medical revolution or a disaster? I think the answer lies somewhere in the middle. There are positive points like encouraging eating real food, reducing processed foods and added sugars, and increasing vegetables and fruits. But there are also concerns about placing red meat and saturated fat too high on the priority list, especially for people who already have cardiovascular risk. And the most important thing I want you to remember is don't follow blindly. Listen to your body, talk to your doctor, and create a diet that fits your individual health condition. Nutrition is not a one-size-fits-all formula, but a personal journey that you need to adjust according to your own needs. I really want to hear your opinion about this new food pyramid, so please leave a comment below about your situation, and I will try to answer all the comments to give you advice about your diet. If you found this video helpful, please share it with your loved ones so they can also learn how to evaluate the new food pyramid objectively. And please like my video so it gets recommended to more people, and subscribe so we can meet again in the next tips. And take good care of your health, because you deserve to live a healthy and happy life. We'll see each other again in the next video.